We're talking $1 trillion over 10 years if he gets his way. Joining us now to tell us all about it, my great pal, Russell Vought, former OMB director and now head of the Center for Renewing America. So, Russ, what do you think of this? You're an expert on health care. You're an expert on budgets. You're an expert on deficits, for that matter, as well. He wants to add, what does he want to add? Dental, vision, hearing. It's going to cost $1 trillion. The Wall Street editorial today, I'll get your take on this. They say, you know, you can get this privately. Most people get this privately. We don't need this except for the low end. What's your take?
Yeah, a couple of ththings are going on, Larry. This is certainly something we can't afford. Medicare is facing a shortfall in 2026, just about 5 years from now. And this is something that we certainly can't be adding untold amounts of unfunded liabilities to the system. Many people can get hearing, dental, vision through Medicare Advantage plans or through Medicaid if they happen to be low-income seniors who are both on Medicaid and Medicare. What this is about is trying to make it so they can drive more health care towards a Medicare for all model where they put out a prospective payment system and force the entirety of the private marketplace to move towards that payment level.
You know, Russ, I think that's a great point. I think that's the key motive for all this. They want total government control, nationalization, socialization of health care. I mean, for example, they hate Medicare Advantage, which turns out to be a pretty popular program.
It is, and people forget it had prescription drugs before the main program had prescription drug benefit. It has hearing and dental. People love their Medicare Advantage plan, and the federal government gets it done at a cheaper rate when it's on that plan because of the way that the premiums are put out for competition. And so this is really all about one thing. It's about a bureaucratic, great society program and doing it the way it was done for a long period of time, as opposed to the way that conservatives have put some choice and some competition in the system to be able to provide better care and at a lower rate.
Yeah, I get it. Somebody's got to give, some point, George W. Bush some credit for that. Wasn't this started under W? I mean, he got a few things right. He cut the capital gains tax, for example. Got that right, too. You can smile at that, Russ. It's okay. He got a few things right.
I'm certainly not, Larry, I'm certainly not going to give credit for a massive increase in entitlement spending. But Republicans do have a way of putting some competition into these programs.
There you go. Okay, that's a partial win for folks who know Russ Vought and me. Russ, let me ask something else. A good story in, I think, the Washington Times. Look, I am a supporter of Manchin's fight against the $5 trillion package and the entitlement state, and I like that he's pushing for workfare. There's some good things going on. I like the fact that Kyrsten Sinema doesn't want to raise the corporate tax. But, Russ, suppose they win, or I don't know what her number is, but suppose Manchin wins and you're down to $1.5 trillion. Don't you think that's a big number? Do we really need a $1.5 trillion addition to our spending, borrowing, and taxing? I mean, no one's really sort of talking much about that.
It's an enormous number, and I think that's the concern that I have. I know that you share it, Larry, and that is that to the extent that $1.5 trillion is deemed reasonable, when this thing gets written, it's going to have the same level of spending. It's just going to have a bunch of accounting gimmicks that allow you to make it look cheaper because you've had artificial sunsets and expiration dates. But there's still going to be mammoth new entitlements, and those two senators may get some policy wins because they're under an amazing amount of pressure right now. But all of the pressure that they've been willing to withstand will come to nothing because of the massive cost that will entail over really decades to come.
I mean, people say, no, I won't say people say. President Biden says repeatedly there's zero cost to his plan, which, you know, started out at $4 or $5 trillion. But, Russ, what about all these tax hikes? Don't we regard that as a cost to the economy, or a cost to the middle class, and a cost to investors, and a cost to consumer prices?
Yeah, I mean, those claims by the administration were totally unserious because they don't understand revenue policy and the way that it has an impact on people's lives. I mean, to be honest with you, the reality is they do. They just want to control the people's lives, and that's why they choose to look the other way when it comes to talking about the impact that tax increases has, not just on economic growth, but the way that people make decisions as families, as small businesses, about whether they're going to pursue opportunity and be able to build their lives in their communities and their churches because they have more money in their pocket.
Yeah, well, we'll leave it there. I love that Manchin is, insisting on workfare. I think that's terrific. That's, we always did. President Trump always wanted workfare too. But at the end of the day, $1.5 trillion is a big number. I don't think America needs $1.5 trillion. I mean, we're doing okay. We're still in the Trump legacy with low taxes. I mean, they're butchering the energy policy, but the economy's in decent shape. If it ain't broke, don't fix it. Russ Vought, I say, save America, kill the bill. What do you think? Save America, kill
Amen.
the bill. Amen. There you go. Well said. Russ Vought, come back soon. Hope to see you soon. Coming up on